Hi, my name is Jamie Clark Smith, and this is my informative speech. Could you imagine having a son or a daughter that has an incurable disease and there was nothing you could do about it? Well, my 11-month-old son, Blake, has sickle cell disease, and me and my husband were devastated to say the least when the doctor gave us the news. We were so devastated and felt so helpless until we educated ourselves more about it. So, in order to care for a child with sickle cell disease, you first need to understand the disease itself. Today, I will be discussing the following topics: how a child inherits sickle cell disease, the types of sickle cell, how to care for a child with sickle cell, and support available for parents with children with sickle cell. So, as cited by StanfordChildren's.org, sickle cell is a blood disorder that a child is born with. So you can't catch it. It's inherited from both parents through their genes. The child has abnormal hemoglobin, and the hemoglobin is the protein molecule that carries oxygen to the lungs and to the rest of the body. Normal red blood cells are normal red blood cells are around and they flow through your bloodstream easily. When you have sickle cell disease, the red blood cells form a crescent moon or a C shape, making it harder to flow through the blood vessels. The blockage causes pain crisis in the child. The child inherits two sickle cell genes from each parent at birth. So next I will be discussing the different types of sickle cell. As cited by the CDC.gov, there are three most common types of sickle cell disease: HBSS, HBSC, and HBS beta thalassemia. The first type is what my son has. He has HBSS, which is he inherited two sickle cell genes, one from me and one from my husband. And this is the most common type, and it's also the most severe. The second form of the disease is HBSC. People who generally have this inherited a sickle cell gene S from one parent, and from the other parent they inherited an abnormal hemoglobin called C. This is usually a more milder form of the disease. And lastly, the third most common is HBS, beta thalassemia. Interestingly, we just found out my husband has the trait, the beta thalassemia trait, and I have the sickle cell trait. But surprisingly, my son doesn't have this particular sickle cell disease. But if another child happens to end up with this particular sickle cell form, they inherit one sickle cell gene S from one parent and the beta thalassemia trait from the other parent. If the child has beta thalassemia O, they have a very severe case of the disease. But if they have beta thalassemia plus, they have a more milder case. Having this disease can be very difficult and very stressing. Take it from me. Going into my next point, how to care for a child with sickle cell disease. So as cited by the University of Rochester Medical Center.org, .edu, you have to take steps for prevention. You have to wash your hands with soap and water continuously to cut down on germs and cut down on getting the flu or even the common cold, because even these types of normal things can affect a child with sickle cell greatly. Also, not consuming raw or undercooked meat, resulting in getting salmonella. That is one virus that you catch that can be fatal to a child with sickle cell, because their body is compromised and it's going to make it harder to fight off any kind of virus or any bacteria. Also, making sure that your child stays up on their vaccines is very important. Each vaccine, even taking the flu shot every year, we're cutting down on the child getting pain crisis because they're up on their vaccines. Also, taking fevers very seriously. Just recently, my son went to his hematologist, and they told us that if his fever got over 101.5, he would need to go to the hospital because he could have some form of infection that we don't know, or there can be pooling in his spleen from the sickle cell disease attacking his body. Even giving him a warm bath or giving the child a warm bath or a heating pad or even medication can help subside some of those pain crises as well. Also, another key point is eating healthy and drinking plenty of fluid. Having a great support system is vital in dealing with something like this as well. Which brings me to my last point, support groups for families dealing with this disease. As cited by Children's Hospital of Pittsburgh, there are support groups available for with parents and patients, families with this disease. One being sicklecelldisease.org. I personally have my husband and my family, my immediate family, or even extended family and friends who check on me, who call us to make sure we're okay because they know this is something very difficult to deal with. Knowing more about sickle cell disease and educating yourself helps with the difficulty of the diagnosis, and it eases your mind when preparing for the hard times that come. So, going over my speech today, my points were how a child gets sickle cell disease, the types of sickle cell, how to care for a child with sickle cell, and finally, support for parents with children with sickle cell. Trust me, educating yourself with the facts helps you better prepare for what's to come down the line. Thank you.